What happens if we just sleep for like 6 hours? What happens to the brain?
When the sleep is disturbed, even for few days, there can be some effects which cannot be reversed. So there is new thing called lymphatics, like lymphatic system in the body, which is a way through which the brain removes the toxic substances.
Doctor, I'm very stressed out, and whenever there is a deadline in the corporate world, I get this headache. Do you see that in your work?
Headache is one of the most common symptoms with which a patient comes to a neurological OPD for consultation.
Dr. Prabash Prabhakaran
a renowned neurologist,
specializes in diagnosing and treating a broad spectrum of neurological disorders such as headaches, migraines, stroke, vertigo, dementia, etc.
Most of the times what I being called from my friend is that their dad or mom, they've been like very sharp before, but now missing things.
A homemaker, she was making a sambar for all these years perfectly. But husband notes that there is a change in the taste and progressively she is not able to make that sambar at all. Okay, something that person has been doing for all this while, she is not able to do. We see a lot of people who are on vegetarian diet have B12 deficiency and come with the dementia.
I'm really worried about these IT people, really, and also people in the creative world. That is the other problem as well. You know, music directors, actors, cine field, and also doctors. They work late nights. And do you have any doctor patients?
Yeah, I do have a lot of doctor patients.
I might be one of them next time.
There is something called gut-brain connect. So when the sleep is not right, there are toxin buildup. It can affect the other way around also. The gut can influence the brain brain can influence the gut.
People take Dolo 650 for headache all the time. Is that okay, or when should they see a doctor?
When the headache is more than 3 per month is where you need a consultation. Up to 2 is not a problem.
Is coffee causing headache or treating headache?
Okay. Most of the people, caffeine is good for headache in the sense if you take a caffeinated drink, it does help. But
having a mobile phone closer to your brain, will that increase the risk of tumor?
So I think the researchers have said no. As of now, it has been, the answer is a no.
So nothing to be really concerned about.
Yeah.
A person listening to this, who wants to improve their brain health. So you're saying that more reading will improve brain health?
Definitely.
What do you do for your brain health?
Before we dive in, can I be honest with you? It blows my mind that 57.9% of you who listen regularly still have not subscribed to our channel. If you enjoy the podcast, the stories, the signs, maybe even laugh at our jokes, could you do us a small favor? Hit that subscribe button. It takes only 2 seconds and helps us keep bringing you better guests and episodes every week. I'm truly blessed to have all your support and I'm sure you will support me in the journey. Now, let's get into today's episode. Hello guys, this is Dr. Pal Manikam. Welcome to another episode of our podcast series Gut Feel Living with Dr. Pal. In this episode, we have a well-known neurologist who actually has expertise in multiple levels of neurological disorders, but we have decided to focus on common neurological problems like headache. What does screen time do to your brain? And what does sleep deprivation do to your brain? Does catch-up sleep of the weekend, does make it difference or not? And how do you handle stress? How can you improve brain health? What does a neurologist do to improve his brain health? It was an information-filled episode. I'm sure you'll enjoy it. At the end of the episode, please make a note of what you learned. I just don't want to have this podcast as just another thing that you learn and you don't implement on your daily lifestyle. I don't want to do that. Please make sure that you make notes of whatever you learned and implement it, or at least read through sometime, at least once later after this podcast, so it gets registered on your subconscious mind. Let's dive deep into it.
Hi, Dr. Prabash.
Hello.
Thank you so much for your time and also for being in my podcast. So excited to see you, and the reason that I brought you in is because you have created a revolution in vertigo treatment here in Chennai, and you currently are in SIMS Hospital, and the idea behind this podcast is to convey important neurological information to my audience so that you wish the patient knew before they come to your clinic.
Sure.
We're going to start with headache first. Okay, so one of the most common thing that I also see in my practice is, doctor, I'm very stressed out, and whenever there is a deadline in the corporate world, I get this headache. Do you see that in your world?
Headache is one of the most common symptoms with which a patient comes to a neurological OPD for consultation with. There are many reasons why we see an uptick in the number of people to come in with headache. Number one, the change in the lifestyle which is happening over the past 2 to 3 decades. Many people doing night shifts. There is already a disturbance in their sleep pattern which is happening. And third, dietary changes.
So doing night shifts increases the risk of headaches.
Yes.
What do they come up with? They say one-side headache or?
Usually, migraine, there are a lot of triggers. And one of the most important triggers is disturbance in sleep pattern. I can enumerate a list where there are common triggers which can cause migraine. Number one is sleep disturbances. Maybe every day, correct time to the bed and waking up on a time will definitely help migraineurs come out of that. And second, 9 hours of sleep is pretty important. Though in a migrainer, it is 9 hours.
So you're telling me if a patient has a headache, if it is a migraine headache, then the patient needs to sleep for 9 hours?
Yes.
They're not even sleeping for 5 hours?
Yes. So 9 hours is pretty important.
Why is that?
When you talk about sleep cycle, you know that there is a set of things which happen during sleep over 9 hours. Okay. So you need to have, first when you go to sleep, you dive into deep sleep for around 90 minutes. Then comes the light sleep and then deep sleep, light sleep. When we start sleeping, the major chunk is deep sleep.
So let's just break it down. So deep sleep is 90 minutes.
90 minutes.
So let's say somebody sleeps, I'm just talking about a common person who works in the IT world or very busy professional. Usually they sleep only around like 12, midnight. Okay, or even after 1 a.m., 2 a.m. So let's say they're sleeping at midnight. From midnight to 1:30 is a deep sleep.
Not perfectly 90 minutes.
On average.
It differs, but usually it is 90 minutes.
On
yes,
average.
You're right on that.
Deep sleep. The second phase is?
Then there is an awakening for maybe a millisecond or so, or a minute or so, and then that's time when we turn around, when we have a deep breath and all, and then there is a light sleep. Usually the initial light sleep for around 10 to 20 minutes. Okay, and then again there's an awakening, and then we go into the deep sleep. This time the deep sleep might be around 60 minutes. So the initial part of the sleep, the deep sleep is the majority, and by the time you wake up in the morning, the light sleep is the majority, where deep sleep is less. So when you wake up in the morning, certain times you are able to recollect your dreams. That's when you wake up from light sleep. Certain times you are not able to recollect your dreams. That's where when you are suddenly woken up from a deep sleep. So that's the difference. So you need that changes at least 6 to 7 times. For that to happen, you need to sleep around 8.5 to 9 hours. That's why the reason 9 hours.
Oh my God. So 6 into 1.5 hours.
Yes.
Which is 9 hours.
9 hours.
What happens if we just sleep for like 6 hours? What happens to the brain?
There are a lot of new studies which have shown that the lesser we sleep, the problems arises in the brain. So there is new thing called lymphatics, like lymphatic system in the body, which is a way through which the brain removes the toxic substances. So for example, an engine is being ran for around 90 minutes or so. It definitely expels a lot of toxic products.
Correct.
Like that, the brain is working, it definitely produces toxins which has to be expelled. So this happens during certain period of time, certain period of sleep. So you need that much time for all the toxins to be removed. That's not the only function. Toxin removal is one of the function of sleep, and other things like rest, memory consolidation, energy. You need to keep the energy for needed things. So a lot of things happen. For that, you need to have that much deep sleep, light sleep, deep sleep, light sleep. A lot of things happen over there. Actually, if you record your EEG during sleep, if you take light sleep, it's almost equivalent to when you are awake. Whatever happening if you record a EEG, except that there's nothing below. There's only movement you can see is an eye movement.
Yeah.
Nothing else moves.
So when you are deep sleep, the only thing that moves is your eyes.
When you're in
sleep.
light sleep,
Light sleep.
that's called REM sleep.
REM
I didn't use the technical term.
Correct.
Rapid eye movement
movement,
sleep.
right.
The other one is the deep sleep is non-rapid eye movement sleep.
So how many cycles of deep sleep you should get? 4, 5?
6, usually 6. That is where I said the timing is. But it differs from according to the age group. In a baby, it's totally different. It can be small burst, and then when you go into the adult period is which I said around 8.5 to 9, and when you go to around 80s, then it's slightly different. We go into like a kid. There's maybe you sleep 6 hours and then few hours in between.
So I'm going to be very honest with you. After being in social media, my sleep cycle has really got into trouble because I used to be in the US, and then all this interviews will happen in India. So I used to wake up at like 10:30, 11:30 at night, and then I used to go to sleep only at 12 o'clock. And I can clearly see that maximum I will get sleep is around like 6:30, like 12 to 6:30, 6.5 hours. So you're telling me that I have missed out on the last phase
Yes.
of deep cycle.
Yes. Not only deep, the
Plus light.
yes.
Plus light sleep as well. So I have missed one cycle of REM and non-REM sleep.
The timings are little, it differs from person to person. Yes,
on
as an average, yes,
on
you're
average.
right.
And I can tell you as a personal experience is this was in 2022, where I would say that I was very busy. Both I was a full-time gastroenterologist and also was very active in social media. And COVID was there, and I just wanted to share all the information. So I compromised on my sleep significantly. So in due course of time, I would say around like 9 months, I could clearly see that I was not the same a year before. I started having, first symptom that I had was GI problem. I had significant bloating, which I never had before. And being a gastroenterologist, I knew exactly what was the problem of. So then I decided that, okay, see, this is really compromising. So based on what you're telling me is, so what has happened to me was, okay, so I slept around like 11:30 and then I woke up around like 6. So missing that one cycle of deep sleep and light sleep combination, accumulation of toxins have deteriorated some part of the nervous system?
Yes, technically, yes. Studies have shown that when the sleep is disturbed, even for few days, there can be some effects which cannot be reversed. There are. What we are talking about is circadian sleep disorders. That is, your body has a clock, and then it calculates.
Correct.
Okay, what is the time now, and then and a lot of hormones get secreted according to that. And what you said was right. There is something called gut-brain connect. So when the sleep is not right, there are toxin buildup. It can affect the other way around also. The gut can influence the brain can influence the gut.
So I was always thinking that I ate a lot of fiber. So I know that my gut lining is pretty strong, but I did not emphasize that much on sleep before. So that was a wake-up call for me. But I worry about the younger generations where I can clearly tell many people were on that seat and then said that, I sleep only for 5-6 hours. What happens if they don't take care of it and they keeps on doing this for like 2-3 years?
So in younger generation, they somehow catch up. But above 40, above 45, they find it really difficult. And there are researchers which shows that these toxins will get misfolded, that proteins get misfolded and accumulate in the brain. For example, technical terms, beta amyloid, those things get accumulated. This can lead to dementia like Alzheimer's later in life. So sleep is pretty important. Sleep, exercise is pretty important. And one more point.
So just, sorry to interrupt, for the dementia part, I just wanted to emphasize on the audience is that, let's say you keep on doing this. The toxins built up and the amyloid plaques can be misfolded, and that can lead to Alzheimer's dementia, increased risk.
Yes.
Which means that you may forget things.
When you talk about Alzheimer's disease, we always overemphasize on memory. For example, a homemaker. So she was making a sambar for all these years perfectly. but a husband notes that there is a change in the taste, and progressively she is not able to make that sambar at all. So that's executive dysfunction. Okay, something that person has been doing for all this while, she is not able to do. Maybe the person is not able to drape a sari. Okay, that itself is, that can be a sign of a dementia. And yes, memory, small, maybe misplacing things. 2, not able to count, that is calculation difficulty, not able to go to a nearby store, topographic disorientation. And then there are other higher things
They will lose directions, correct?
Directions, and other things like they are not able to remember a face. There is specific prosopagnosia where they are not able to recognize a face, and they might miss a tree for a forest. There are these are all higher functions. So there are ways to pick that up. So then there are simple things like anomia. They forget names. So it's not really about memory. It's about cognition. And there are behavioral changes. Someone who was very sober, but suddenly has become a totally different person who gets angry day in, day out. Someone who was a very angry person, but suddenly has become contented with himself, keeps up with himself. So these are all subtle signs of dementia.
What age does it happen?
It can, recently we are seeing little younger people also getting it, above 45, 50, but usually above 65. That's 65. The usual age.
In my practice, I saw a patient, 44-year-old, abdominal bloating, and the first question that we ask when the patient comes to abdominal bloating is, well, how often do you sleep? And they have been compromising their sleep for the last 15 years. And it's a very classic example. They are in the US, and their client structure is in India, and then they always have late nights, and they wake up they sleep only at 2 a.m. They've been doing this for 15, 16 years. And the reason that they were there right after my clinic, the neurology clinic, is because the husband forgot the key of his electric car.
Okay.
So they have to open the app. And they forgot the passcode. They forgot the passcode. And because the electric car, they were not able to charge. And it just completely got down. Even though it sounds like a very common thing, but there was a significant disease for him that we were able to identify. We did an MRI of the brain. As you said, the amyloid deposits were so significant. That reminded me, and then they were kept on asking, okay, why did this happen? Is it genetic or anything like that? Then I said that maybe the lifestyle increased the risk of what he is having right now. And the family was like, I wish I knew this before.
I'm not surprised with what we're told. A smart person, not intelligent, a smart person actually can mask. They're not wantedly doing it, but they can mask their dementia. Means if their fund of information do matter. If the person has only, if for my teacher used to say, if a person has 100 rupees, he can definitely lend 10 rupees. But if the person has only 10 rupees, he cannot lend more. So the fund of information, more you read, the more information that you have in your brain, making use of it. So that really helps slow down dementia.
So a person listening to this, who wants to improve their brain health. So you're saying that more reading will improve brain health?
Definitely, more reading. A simple thing, look, sudoku or some calculations. So keep using. I'm not batting for sudoku, but I'm saying that does, look, some action, something that definitely helps out the brain. It's like an exercise for the brain. More you use it, more sharper it is.
What do you do for your brain health? As a neurologist.
Okay, definitely yes, exercise. I do run a lot, daily at least 45 minutes of running. I do swim for around 20 minutes and cycling, weekends at least around 3-4 hours of cycling. So exercise do matter. It definitely make new connections in the brain.
So exercise will prevent the risk of dementia.
Yes, dementia. Yes, that's scientifically proven. We are actually in the cusp of a revolution in the next 10 years. So there are a lot of new drugs in the pipeline which is coming in. But right now what we have is good sleep, good exercise, and a lot of increasing the fund of information in the brain definitely helps to slow down dementia. Whenever we talk about dementia, we always tend towards Alzheimer's. There are a lot of treatable dementias. Yes, Alzheimer's, it's a syndrome. You do have to follow a strict guideline to diagnose Alzheimer's, but there are a lot of treatable things. For example, vitamin B12 deficiency. It's pretty easy to correct. Number one. Number two, hypothyroidism can cause. Third, certain times there's something called pseudo-depression. Pseudo-depression can present like a dementia. So you need to, it's a treatable cause. Then NPH, normal pressure hydrocephalus, where there's an increased fluid content in the brain, which can compress upon the brain parenchyma and cause dementia. Again, a treatable cause.
Tell me about the B12 deficiency and dementia. Tell me a patient that you have seen. The reason I'm asking is, many people are concerned that they have low B12 because of poor dietary intake, especially in vegetarians.
Exactly. We do when we get a dietary history, if it's a vegetarian, obviously we have to do B12 assessment. But in a vegetarian, obviously yes, we see a lot of people who are on vegetarian diet have B12 deficiency and come with a dementia. We do see a lot.
And the clinical presentation is like just forgetting things.
Yes, it can be any form of dementia. Memory is one part, as I said, any part of cognition.
So dementia is not only memory.
Yes, dementia in memory means when the temporal lobe gets involved, then it's which lobe gets involved. If it's the lobe in the frontal lobe, that usually is for executive functions. Like frontal lobe is what makes me Dr. Prabash and you, Dr. Paul. It's by everything else is the same, but the frontal lobe is what makes us our own a personality. So that's frontal. So when you talk about the parietal, it's where calculations, the topography, all those things comes over there. For temporal lobe on the left side, that's the dominant side, which takes care of memory. That's where we talk about when usually the temporal lobe is involved. That's why we associate memory with dementia. And right side temporal usually takes care of music. And grammar, all those. And the back behind takes care of vision.
Most of the times what I being called from my friend is that their dad or mom, they've been like very sharp before, but now missing things. If they notice something like that, is it reasonable to take their parents for a neurologic evaluation?
Yes, it is. Because there are when we start early, we are able to control things. At least we can slow down the progression. Number one, yes, we need to rule out treatable causes. And then even if it's other things, we can slow down. And there is something new which has come, which is autoimmune dementia. It's now I would not say it's pretty common, but we do evaluate for autoimmune dementia because it's again a treatable cause. We do obviously you would have been seeing a lot of autoimmune diseases in gastro.
Yes.
Like that it has taken it like a storm now. We have seen a lot of autoimmune neurological illness, especially involving elderly people.
I was involved in a research with UCSF, University of California, San Francisco, where fecal transplantation for dementia. It is just basic research and it is very preliminary stages, but promising results, which is really mind-blowing that the gut is strongly connected to the brain, where you replace the bad gut bacteria with the good gut bacteria. Microbiome. The dementia, the highlighted areas of the brain on MRI, you will not believe how it glows. It will take some time to be translated into human medicine, but one thing that we can take is probably, it may not be completely cured, but controlled by proper diet. That is something that we have been highly advocating to all my patients throughout.
2 drugs got approved recently for specifically for treatment for dementia. It's coming to, I think it'll be coming to India sooner.
Have you seen Gajini movie?
Yes.
What does Surya do?
He always write down things to remember.
Is that common in your practice?
No, I have not seen much. But still, look, I have seen many people, as I said earlier, smarter people. When we see them, we will not say that they have dementia. But when you do the scoring is 30, they will score 16, 17. We'll be surprised. That's their smartness.
So it's called MMSE, correct?
MMSE miss out a lot of things, but then it's a basic testing, which will definitely get us some information.
Yeah. I think I want to emphasize the audience on MMSE. It's a very important tip. So let's say usually the dementia happens around like 55, 60 years of age.
Usually,
And my
right.
audience is around like 30 to 40 years of age. Demographics are more common.
Okay.
So their parents are the main targeted patients over here. So let's say that if they are thinking that their parents are forgetting, tell the person listening how they can help their parents to identify with this simple MMSE score.
MMSE can be done by anyone.
Anyone.
Okay, it doesn't need a medical training and all.
Correct.
You can just mini mental scale examination. It's just a series of questions. The total score is around 30. It's common question like date, which date, month, year, which place is it, which floor, which state or which country. So there are, and then you give something and then ask them to remember it, and then you ask some other questions, and later you come back and then ask, what did I say? Can you remember those? Very simple things. You can just see in the net MMSC. You can apply it yourself.
Correct,
It's
correct.
pretty easy.
So I highly recommend everybody to look at the link in the description, MMSC. I want you to try first and then try on your parents. You might be surprised. Okay. So coming back to sleep, you said that the young people can catch up. So let's say that they have been sleeping only 4 or 5 hours and they're doing this for like 2-3 years. They also argued that, hey, I'm sleeping on the weekends more. If the catch-up sleep helps?
No, it's actually troublesome. Look, in a situation where you cannot, there are certain people who are struggling in life. So you cannot apply it for them. Okay, they have to. So in those people, yes, definitely the catch-up sleep is needed. Okay, but usually it is troublesome because it disturbs the circadian rhythm. Look, you have a body clock and it has to work in a pattern. If you disturb the pattern, it will cause disturbance. For example, is shift work disorder. That is when you do night duty and for some time and then day duty. Look, the body doesn't work the body has to rearrange itself. Many hormones are secreted exactly on timing, based on timing.
So you are saying that binge watching Instagram reels will affect your sleep?
Yes. The reason is the blue light emitted from the screens is equal to the sunlight. The body picks it up, the retina picks it up and sends to pineal gland, and the gland
Pineal gland is the tiniest
it's
gland.
a tiny gland and in the brain which presumes that still it is daytime. Okay, so it will not allow the melatonin to be secreted. Melatonin is secreted when the body feels it is dark, and then the cortisol secretion will go down and melatonin will rise. So when you keep binge watching, what happens? The brain will get confused and it thinks that it's still daytime, and so it shouldn't secrete melatonin. Just imagine it's happening over months and years. It does have an effect on the brain, irreversible effects.
So I'm going to paint a picture. So everything is dark outside, and then you are looking at the phone, and the blue light is going into the brain. And the brain initially thought it was dark, melatonin is secreted, but because the blue light is coming in, it is almost similar to the daylight. So the brain gets confused, but since it is very closer, it thinks that, okay, you need to be very awake. And then melatonin stops. So that is why you are not getting the 9 hours of sleep. If you don't sleep repeatedly, and if you keep on having the sleep deficit, and also you are stressed out at work or family or any kind of thing, will that shrink your brain? Will that decrease your neuronal?
You're driving a car and had a small accident. How will your position that time be? You'll be a little shaken.
Yeah, tensed.
So there was nothing really. The car didn't hit you, but still you are a little shaken. That's because a lot of chemical changes happening over the brain. Imagine this happens day in, day out. Obviously, it will have an effect. I'm trying to give an example. Okay, this is not a scientific answer,
Correct. No,
but trying to explain.
that's helpful. Yeah.
I'm trying to explain it.
That's how damaging it is.
Obviously, yes. It does damage us. And yes, it will have an effect on the blood pressure. It will have an effect on the glucose levels, stress over time.
Obesity.
And add to it the OSA, obstructive sleep apnea. So it's going to be it's a mother of all diseases.
So you're saying so many patients, right? What is the average sleep time that they have?
Actually, right now, the average sleep time around 5.5 to 6 hours. That's the average sleep time.
Are you seeing a big epidemic of diseases going to happen 10 years from, right? That's not good. I'm really worried about these IT people, really, and also people in the creative world. That is the other problem as well. Music directors, actors, cine field, and also doctors. They work late nights. And do you have any doctor patients?
Yeah, I do have a lot of doctor
A lot.
patients.
I might be one of them next. Wow. Sometimes, when you walk into the room, and sometimes you forget why you came. Or you are talking to somebody on the to-do list and then you just forget. Or you come to the grocery store and you don't know what you're buying. Are these red flags or is it?
No. Look, unless a thing get registered in your mind, and then it has to circuit. There's a circuit or paper circuit where it revolves around, and then it gets stored. Unless you register it, it's not going to. So these are all normal things. A thing to get into the memory, it should get registered, and then only it will get into. When you do multitasking, you tend to miss out certain things. I don't think
that is
it's
okay.
need
But
not
if it
worry.
keeps on happening persistently,
Yes.
that is the
Then
problem.
we need to look at it.
Okay, sounds good. Super. We were talking about headaches before, but let me just pinpoint a little bit. People take Dolo 650 for headache all the time. Is that okay, or when should they see a doctor?
When the headache is more than 3 per month is where you need a consultation. Up to 2 is not a problem. When you get more than 3 a month, it's a general consultation. But imagine a person who is having a disabling headache. Maybe it's monthly once. You cannot, but then again that qualifies enough. Look, though the guideline says 3, but a disabling headache needs consultations. Usually, answering for your question, it's around 3 per month.
More than 3 per month, or one headache which is
maybe
really bothering.
Yeah, really bothering, you need to. And first headache, you never had a headache all this while, and especially above 50, you have a first headache which is severe, disabling. That's a red flag for sure.
And especially if you're a high blood pressure.
Anything, any new onset headache above 50, it's a red flag. We need to consult.
Are you seeing more of brain cancers, brain tumors?
Yes, we do see a lot. Maybe there are a lot of things which can go, for example, the sleep, the diet that we all talk about. Also, maybe we are picking up
More cases.
We should be looking at that aspect.
Correct. The diagnostic capability has
Is
gone
better
up
now. It's better now.
compared to before. And another random question, whether it's up to you whether you can answer or not. Having a mobile phone closer to your brain, will that increase the risk of tumor?
So I think the researchers have said no. As of now, it has been, the answer is a no.
So nothing to be really concerned about.
Yeah. The recent researchers have told that it is not that a risky level to be red flagged.
But still, don't keep your phone right next to you because of the screen time.
Screen time, also radiation, yes. But though the science have not proved, the things are changing. New researchers will come. So better to keep distance as much possible.
I'll keep my phone in the other room. I'll keep everything out. I'll keep my phone out. I'll keep my wallet out. I'll keep my wife out. You know why? Because she's the light of my life. So the other thing, people are applying Amrutanjan for headache. Yes, no?
No.
No.
No scientific evidence.
No scientific
scientific evidence.
Local vasodilation, nothing.
No scientific
I was
evidence.
just trying to help Amrutanjan. Okay, how about coffee? Is coffee causing headache or treating headache?
Okay. Most of the people, caffeine is good for headache, in the sense if you take a caffeinated drink, it does help. But it should be before 4:30 in the evening. Okay, beyond 4:30 in the evening, definitely is going to cause an effect on the sleep, a negative effect on the sleep, indirectly triggering a headache.
Because the half-life of caffeine is more than 6 to 8 hours. So caffeine actually disturbs the circadian
rhythm, and the sleep is disturbed. So again, it triggers headaches. So that way, yes.
I did a reel with my wife saying that, don't drink coffee after 5 p.m. It disturbs circadian. In the comment section, if you look at it, everybody was saying that I drink a full cup of coffee and I go to sleep right away. It is not bothering me. So it is not individualized.
Mostly, yes. It is. I think I don't have a research on that.
In your practice.
In my practice, I see that
general recommendation.
No, general recommendation is 4:30. I've been very clear on that. 4:30.
But people come back from office around 6:30 and they will have the filter coffee.
People who are suffering the headache takes my word. For sure. Because look, they don't consult. Look, headache is common. They have been using the medicine Dolo for all this while. But when they consult their doctor in India, in Chennai, definitely they have come after suffering a lot. So they do take the advice.
And do they take advice for the sleep as well?
Yes,
they take it
but
seriously.
Then 9 hours is a little difficult. Look, in our situation where a kid has to go to school in the morning hours, and someone working, the spouse is coming little late, so it is little difficult. But they do try. Look, people who are really struggling do try, and I've seen
minimum
that,
7 hours.
and I've seen that partners do help them. They realize that, okay, if she has a headache, then the whole house goes for a twist. So I'm okay with her sleeping.
Oh my God. Okay. All right. So, and then migraine headache is something different from tension headache.
Yes.
So, when you are having a deadline, when you are trying to meet, that is tension headache.
It's usually tension. It usually comes in the evening hours, and it's usually bilateral. Migraine is usually unilateral. There are certain differences, and the treatment options also differs little.
Super. And we will talk about a little bit about, because you are a specialist in fainting and dizziness.
Vertigo.
How do you differentiate between fainting and dizziness or vertigo?
Look, it's from the history. When a person says that when during the episode I'm not able to hear what was happening around, then that becomes fainting. When a person is very clear that, look, I had severe episode, but still I was trying to call someone, they were trying to communicate with me, I was able to clearly hear what they were talking about, then it shift towards dizziness or vertigo. That's purely from the history. And I'm sure 100% of the times you'll be able to make that out from a good history.
And like even my wife complains of dizziness repeatedly. Any common reason for that? Common cause for a patient to come to you?
Look, when a person comes with the dizziness, we usually put them under 3 brackets. One, is it acute, the first episode? Second is episodic. They have been having it for several times, but episodic. And third is a chronic dizziness. That is, they have been having it almost daily for months or years together. The diagnosis differs in all 3 headings, and the treatment depends on the cause.
When should we come to you?
The first attack.
Is it right?
Yes. I'll tell the reasons. Number 1, dizziness is one of the symptoms for a stroke. Okay, so if there is a dizziness or a vertigo, if it's stroke, we can revert it. Number 1. Number 2, vestibular neuritis. There's an inflammation of the nerve which connects the balance system to the brain. If you pick up on day 1, an dexamethasone steroid injection, 1 or 2 days will cure it completely. If the person comes late after around 3 weeks, the chances of recovery is little less, and then it can be lifelong problem. And third, if it's a migraine, vestibular migraine, earlier you come, it can improve your productivity. Definitely you can control the symptoms better. So as early as possible. There are simple reasons also: hypoglycemia, hyperglycemia, hypertension. These are all common things. So I think we shouldn't neglect in a vertigo or a dizziness. The earlier, the better.
Beautiful. Nice. And then a quick word on the seizures. Okay, so people call it as fits. And most commonly when people say fits, they think that like giving the key or like any metal to the hand of the seizing patient, and that will help. What is your take on that?
So it's pretty superstitious. It happens in India, especially in South India, that we see a lot. They search for a key. What happens here is, by the time the person goes, search a key and come back, it's around 2 to 3 minutes. That's the usual duration of a seizure. It settles on its own. It's not that you give the key. So usually a seizure doesn't last more than 2 to 3 minutes, usually. But if it's more than 3 minutes, then it's a medical emergency, because it can reduce oxygen supply to the brain. The person can aspirate. So a lot of complications can come if it is more than 3 to 5 minutes. So you should rush the person to a hospital. If you ask me first aid, you better that you turn the person to left side so that he don't aspirate.
Got it. So let me rephrase that.
Yeah.
So what should a person do when somebody is seizing right in front of them?
Right. First up, if the person is, if he fell down, make sure that he is in a flat space where he cannot fall down and get injured again. Number 2, turn him to the left lateral position,
Left side.
so that left side, so that the person doesn't aspirate. The whatever saliva is coming will come out through the angle of the mouth.
So that it doesn't go inside the lungs.
Go inside the lungs.
Because if it
Aspiration-
goes inside the lungs,
it can cause pneumonia, infections,
Infection of the lung.
and then problems.
so as soon as you see somebody sees, you turn them onto the left
Side. And the third, if you are wearing a tight dress, better to loosen it up little, and then don't try to restrain the person. That's where the problem comes in. Just leave him free, and you can keep some soft material below the it can be a shirt or something, some cloth below the head, so that it doesn't bang onto the floor and then the person getting injured. So and then shift him to a hospital as early as possible. Don't give him anything orally.
No
That's
water.
No water.
People give
the,
water all the time.
Again, the person can aspirate. So avoid anything where, and then they try to put their finger to prevent tongue bite.
Tongue bite.
What happens is the person who's putting the finger can get injured. Don't do that.
And the water, not giving water, because it's a very common thing. Everybody thinks, oh, so give some water. The reason is their reflexes are numbed. So when you
They
drink
can aspirate.
Drink water, it will not go into your foot pipe, it will go into your windpipe.
Yes.
Goes
And
into
cause,
your lungs.
and cause asphyxia. And its aspiration, immediately there will be problems.
And decrease oxygen to the blood.
To the blood.
And I've seen a patient die actually because
seizure?
of giving water. They
During
had seizure.
Okay.
The bystander wanted to actually help the patient, so wanted to try to give the water that he had in the car. And the water was just pooling in the mouth because he was not able to swallow.
Maybe aspiration, maybe there is some term, usually we don't use it in common parlance, it's called SUDEP, SUDEP, sudden unexplained death in a person with epilepsy. The reasons can be multifactorial.
I see.
And one can be aspiration, one can be hypoxia, one can be the heart rate abnormalities which might come. So this is common when the person has more attacks and the person is more on multiple anti-epileptic drugs.
Okay, super. One few things about Gen Z. Okay, do you think Gen Z people are? Do you know what Gen Z is?
Yes.
I just learned recently. Do you think Gen Z people are? They are using this term depression a lot more commonly. Are they really depressed, or they are just better expressing themselves?
They don't like to sit idle.
Yeah.
Okay. And then
they cannot handle boredom.
Yes. This is something that I have noted. This might have an effect on the depression part is my
I'll tell you my thought process on this. If you cannot stop yourself looking at the phone when a car is stopping at the signal, you have a problem. If you are not able to stop yourself looking at the phone while you are standing in line in the grocery store or getting a ticket in a railway station or something like that, you have a problem. The reason is the attention. You are not able to handle stillness. And stillness is something that is still missing. Right. So the reason, I think what has happened is we have been occupied with so many devices where it's easily distracted. One thing a person who's listening to this podcast who want to improve their brain health is we need to train our brain to handle boredom. It is okay. Nothing is going to go wrong if you, and that is why they say walk in nature is something like you need to incorporate. The reason is not just because, it's a walking physical activity. What I have read and also felt is that when you're walking, the stress levels are being absorbed pretty much by the nature around. If you focus on, for example, in the eastern side of United States, there is a beautiful fall season in September and October where the leaves fall and the new leaves come with beautiful colors. And all the northeastern part of the United States, they don't have any sunlight. So they are pretty depressed to start with. They actually look for this kind of trips where they actually see what kind of color, what is the withering, what is the density and everything. When they do that, I think it absorbs somehow the stress levels or something like that, which makes them more be present. That is something that we are really missing.
Also, the screen times, we are seeing even young kids are being exposed to screen. I've recently attended a meeting where I learned that autism, the younger you give the screens, there is a little uptick in the autism percentages that we are seeing. That's something that I learned recently. So
Increases the risk.
I think, and there are something called virtual autism where it's because of the screen. The moment you take out screen and somehow you make them understand, take out screen, they come back to their normal levels.
So it is kind of a reversible thing.
I'm not a pediatric neurologist. I'm an adult neurologist, but I just learned recently about this.
No, I'm not surprised because, it's all coming down on the same umbrella. One of the other neurologists in the US, they said that he never gives screen at all in terms of like devices. And he said a phone can be given to my kid only at 16 years of age.
Okay.
Do you agree?
It's very difficult here.
You okay?
The peers are there, the peer pressure. They say that no, look, it's very, from 13, it's very difficult, as you know.
Correct.
And the peer pressure, you won't be able to, I don't think it's easy to control.
So that neurologist was saying that I know how bad the damaging effects are and I don't want my kids to go through. So we have made a strong line in the family that no screen, no devices until you turn 16. I will help you in all the other angles. This is something that I'm taking a strong line. And I will give you other leniency that what you want, and that is working in the family. And what he said was, we chose 16, but you can figure out something that works for your family. But multiple research have shown that devices will be handled more maturely when they turn
16.
16 is the magic number, what he said.
But the problem with that is recently there are schools and many you need to get the
iPad.
digital iPad. So whether to draw a line is not that easy.
So I always say moderation both in eating and also in screening. Moderation eating and screening. Beautiful. We're going to wrap up by my favorite topic about diet for brain health. Okay. Any particular diet that you would recommend for brain health?
Look, if you ask me, the Mediterranean diet, that's what people definitely suggest. Fiber rich and in moderation, everything. I would stop that way.
I'm glad that you brought Mediterranean diet because multiple studies, even in gastroenterological literature have shown that Mediterranean diet is one of the best diets out there. Basically, what they are mentioning is the pyramid where you have all the fruits and vegetables right at the top and your protein sources, and all your ultra processed food will come right at the bottom. Yeah. So basically, go from top to the bottom as much as possible. It's Mediterranean, it's Middle Eastern, right, in that area. So if you go to like a Middle Eastern restaurant, if you should look at it, they will have the proportion of the macros distributed very evenly. The carbs, yes, it will be there, but not that much. Right. And they will serve with all your fiber-rich fruits and vegetables, right? Eggplant is one of the main thing in their menu. So I absolutely love Mediterranean diet and also Middle Eastern cuisine. So that is something that we can translate to our Indian diet as well by just adopting the same format. And so a person listening to this has taken from a neurologist as well that Mediterranean diet is one of the best diet for brain health. What do you eat?
Number one, morning an ABC juice. And dosa, 2 dosas.
Apple, beetroot and carrot.
Yes. And then dosa, 2 dosas with a sambar or chutney, and then a fruit. This is commonly I do. And then a cucumber somewhere around 11:30. And then lunch consists of mostly a meal with a small amount of rice and a lot of vegetables around.
Nice.
And by evening, almonds and some other some nuts, and night a small dinner. That's it.
What time?
Somewhere around 7:38.
7:38. What
That's
time
little late. That's little late, but still.
No. It's very early. It's very early for many people. 7:38.
7:38.
Okay. People listening to this, very be careful that your neurologist is finishing the dinner by 8 p.m.
There's a reason. I have GERD, so obviously I need to give a gap.
Give a gap.
So that's the reason why I complete little early.
Neurologist finishing by 8 p.m. Gastroenterologist finishing by 7 p.m. When is your first bite the next day?
First bite. Okay.
Bite in the morning.
Next day morning, 8 o'clock.
8 o'clock.
8 o'clock.
So you maintain the 12-hour fasting.
Yes.
Beautiful. Super. Very nice. Wonderful discussion. If one thing that you want to tell my audience listening to this podcast, if they can start doing it from tomorrow to make sure that they have a very good brain health and prevent the risk of dementia, what do you say?
Sleep is for the brain, from the brain, by the brain. So sleep, number one, is the most important thing. 9 hours of solid sleep. Go to bed on time. Go at same time every day as much possible, and then wake up on same time as much possible. Number two, exercise. Brisk walking. You don't need to run. A brisk walking is more than enough. 40 minutes to 50 minutes of brisk walking. If you can run in a moderate, if you can increase your speed, interval training, it's more better. And if you can add a weight training, much better. And then give a lot of work to the brain. Read a lot. As you have a lot of fund of information, the chances of you getting dementia is pretty less.
I wanted to quickly tap your knowledge on that. Reading negative news, will that affect the brain in any way?
Definitely, yes. Look,
It
all
does?
this, what we think is us. So it's better that you select what you read is also important, but reading something is better than reading nothing.
Super. Very nice. Thank you so much, Dr. Prabash. You are amazing.
Thank you.
And I'm sure that the audience have picked up a lot of information on this podcast.
Thank you.
Thank you. Bye.